I asked Republican Senator and doctor Tom Coburn what he thought of Obama's health care policy.
We have government-run health care where at least $80 billion a year is defrauded. The government can't run it efficiently. They've set up a system that's designed to be defrauded. So President Obama wants to create a public plan. Well, public plan will eliminate all private insurance because it'll be cheaper and everybody will go towards the cheaper plan, which will end up getting subsidized, and ultimately it'll collapse on itself. We won't have the money to pay for it because we'll run it just like Medicare or Medicaid or some other plan, and which will be highly inefficient. And so we'll morph into a government-run health care plan. And if we do that, then we'll fall to the same problems that every other nation that has run government-run health care, is you control costs through the bureaucracy and you ration care. And we should not, look, we have great outcomes in this country. Cancer cure rates are 50%, 30 to 50% better in every area than anywhere else in the world. Why would we want to sacrifice that? If it uses other than a market-based model to create access for those that don't have care, I will adamantly oppose it because it will ultimately change where we have a government-run health care program. And then we'll have a two-tier set of health care. The very wealthy in this country will have one set of health care, and everybody else will have something much below that in terms of the standard of care.
I'm joined now by Christina Romer. She's the head of the President's Economic Council. Ms. Romer, thank you so much for joining us today.
Great to be here.
I want to start out on jobs. We have a very bleak jobs report that just came out. Unemployment now at 8.1%. That is the highest level since, I believe, 1983. Is this better or worse than you expected?
I'm afraid it was basically what we were expecting. The president has been so careful to be honest with the American people and say it would get worse before it got better, and unfortunately we are seeing it getting worse. And even though we knew it was coming, it's still, of course, a tragedy for the American people losing their jobs. I think the main thing I want to say to them is we have a plan in place and we fully expect to turn this economy around.
Moving now to healthcare, the topic of the day. At the healthcare summit you just held at the White House, the president said that his priorities are expanding coverage and cutting costs. But aren't these two difficult to achieve in tandem?
Oh, I think his point is they absolutely have to be achieved in tandem. In fact, he was very forthright to say you can't just increase coverage if you don't bring costs under control. And so he was really putting the focus on we have got to do fundamental reforms to bring that healthcare cost growth down to a more reasonable level. That's the only way to keep our budget in balance. It's the only way to keep our firms competitive. And it's the only way we can realistically expand coverage as well at a reasonable price.
But what exactly are those reforms? Because experts all seem to say that in order to really get costs down, you really need to do some very painful things. You have to place limits on optional procedures. You have to address the malpractice issues so doctors don't practice such defensive medicine and order so many tests and procedures. You even have to get the insurance companies out of Medicare and enable Medicare to start negotiating for prescription drugs. These are big things that lawmakers don't seem to agree on.
Oh, I think, so the crucial thing is, before we ever started, we identified $300 billion of cuts that we can do to Medicare to try to get costs starting to get under control. The other thing I think that experts are so passionate about, there are almost billion-dollar bills lying on the ground that we are doing. There's enough inefficiency, enough times where different parts of the countries have very different kinds of care without different outcomes, that there's just so much we can learn about best practice. We firmly believe you can improve quality and control costs.
Healthcare is a challenge that, as you know, has eluded many presidents. Do you get a sense that this time around, and at the healthcare summit yesterday, that you saw some areas where Democrats and Republicans can agree on policy changes?
Absolutely. I think the thing that was the most striking about the summit was the closing session where you had the representative of the insurance agencies, doctors, Republicans, Democrats. I haven't heard such an outpouring of support, of an agreement that this is a fundamental issue to take on. It does just feel like the moment when we can actually solve what has been, as you described, a problem for a good 70 years.
So where exactly are those areas of agreement besides just generally agreeing that something needs to be done?
I feel the sense that focusing on costs is absolutely essential, that I think everyone understands that at the rate healthcare costs are rising, they really are going to bankrupt the government, they're going to bankrupt firms, they're going to bankrupt households. And so that there is just a shared sense we've got to get this under control and do what it takes.
Now, we know that as First Lady, Hillary Clinton was obviously very instrumental in trying to get health care reform passed. Now that she is your Secretary of State, what kind of role is she going to play in all of this?
My guess is she's very busy being Secretary of State. We've got some fabulous people. Kathleen Sebelius coming in as our new Health and Human Services Secretary. I think there's just a tremendous amount of talent ready to pick up the ball and run with healthcare.
And then finally, what kind of timetable are you looking at? What can the American people expect as to when they might actually see a health care reform plan?
The president has said he'd very much like it this year, and so we will, on top of all that we're doing to get the economy back to health and to deal with so many of our other long-run problems, this is one of his top priorities. So we will be working hard on that, and I know Congress is already starting to talk about it, ready to run with it. So I think that's a realistic goal.
Christina Romer, the head of the President's Economic Council, thank you so much for joining us.
Great to be here.